For my research paper, I decided to look at ACL injury prevention programs. Looking at the effective ACL injury prevention programs for collegiate female soccer players over the course of a 4-year period is where I started my research. The ACL is a critical component in stabilizing the knee joint. The ACL helps prevent the tibia from sliding anteriorly on the femur. As we know, this can be especially important in running, jumping, cutting, landing, and pivoting motions. Unfortunately, females have a higher risk for an ACL injury, and this injury rate has increased in the female athletic population over the last decade to where the number of ACL injuries by females surpasses male ACL injuries. And also, females tend to be 2 to 8 times more likely to sustain an ACL injury than men. Some of the differences that researchers have found as they've studied and looked at the possible factors that have increased the risk of injury for females have been found to be biomechanics, landing techniques, hormonal imbalances, neuromuscular adaptations, and muscle imbalances. The purpose of this study was to determine which ACL injury prevention program was most effective in reducing injuries for NCAA Division I female soccer players over a 4-year period. This study used a longitudinal design as participants were studied over a 4-year period. And also, since participants were randomly assigned into one of 3 treatment groups, this study is a true experimental design study. 200 athletes from 6 different NCAA Division I female soccer programs were divided into the 3 different groups. Group 1 participated in neuromuscular training. Group 2 participated in a hip and hamstring training program, while Group 3 was the control group receiving no training at all. Each of the participants participated in an injury prevention program 3 times a week prior to the season starting and continued throughout the season twice a week. Neuromuscular training group only used individuals' body weights as well as resistance bands to help improve core strength, proprioception, stability, balance, etc., while the hip and hamstring training group used free weights, resistance bands, and other exercises to help increase muscle strength and recruitment. A NOVA was performed at a significance level of 0.05. Neuromuscular training integrated jump landing maneuvers, lower extremity strengthening, and core stabilization, teaching athletes how upper body, lower body, and trunk control can improve posture stability by refining strength and balance. Neuromuscular training also has 4 typical imbalances that researchers have commonly found associated with women more than men. Those 4 imbalances are ligament dominance, quadricep dominance, leg dominance, and trunk dominance. The hip and hamstring training group performed exercises to help offset some of the biomechanical quadricep dominance often seen in females, and to also strengthen gluteus muscles. In order to do this, some of those trainings included single leg squats, leg press, monster walks, side steps, as well as hip adductor strengthening exercises. While the hip and hamstring training group saw injury rates decrease, the neuromuscular training group saw a greater reduction in ACL injuries over the course of a 4-year period. and effectively has been shown to reduce the risk of an ACL injury in females anywhere from 25 to 83% in high-risk landing and cutting sports. Soccer is one of those important sports. As athletic trainers, understanding the risks associated with ACL injuries, we should be able to implement appropriate prevention methods to help reduce the risk of injuries. It is our responsibility to keep athletes safe. And if implementing an injury prevention program is the way to do it, we know after this research that neuromuscular training shows the greatest reduction in ACL injuries among female athletes. And here are the references used for the paper.